Control Shower. My student number is 804 000 348. My supervisor is Amy and my workplace mate is Green Cross Vets Rilla. Today I'll be talking about a dog we have here in the isolation ward. He's coming with the parvovirus, Haku. So yesterday this little fella came in very sick, showing signs of the virus, so he has been put in the isolation ward. But before we go and check out Haku, I'll give a brief description about the parvo. Okay, so parvo is highly contagious and resistant to the effects of heat, detergents, alcohol, so it can remain in the environment for up to a year after the infected dog has been there. This is why the virus can reoccur, especially in unvaccinated dogs or in dogs where vaccinations have lapsed. Due to this stability, the virus is easily transmitted via the hair or feet of infected dogs, contaminated shoes, clothes and other objects. This means that even if your dog never goes to the park or mixes with other dogs, it can be exposed to the virus in the environment. The feces of the infected dog can have a high concentration of viral particles. Susceptible animals become infected by ingesting the virus. Subsequently, the virus is carried to the intestine, where it invades the intestinal wall and causes inflammation. The way parvo is prevented is to keep up with your dog's vaccination. As for puppies, they need to start having their vaccine from 8 weeks and then every 3 to 4 weeks up to 16 weeks of age. You must not take your puppy out in public to parks or beaches at least 2 weeks after the 16-week needles. It is important to note that many dogs may not show every clinical sign. Parvovirus may affect dogs of all ages, but is most common in dogs less than 1 year of age. Young puppies less than 5 months of age are often the most severely affected and the most difficult to treat. From the first symptom, you need to get the dog to the vet immediately, as this virus acts quickly. Example, 48 to 72 hours. Diagnosis of parvo can be challenging because the clinical signs can mimic other diseases that can cause vomiting and diarrhea. The positive confirmation of parvovirus infection requires the presence of the virus in the feces or the detectation of canine parvovirus antibodies in the blood serum. Occasionally a dog will have parvovirus but tests negative for virus in the feces. Unfortunately, this is not a common occurrence. As with any virus diseases, there is no treatment to kill the virus once it infects the dog. However, the virus does not directly cause death, rather it causes loss of lining of the intestinal tract with dehydration, bloody diarrhea, vomiting, weight loss and weakness, fever, lethargic, dehydration and anorexia. If a dog comes into the clinic with parvovirus, I would notify the vet that is meant to see the dog and let him know that the dogs are showing signs of parvo. We would get the dog immediately assessed, the dog then taken to the isolation ward. A nurse would get ready to take the dog down to the console and then down to the isolation ward. The nurse would get ready with the appropriate PPE. We would F10 the consultation room that the dog had been in. The dog is not to come out of the room, or treatment is to be done in the isolation room. The appropriate PPE must be worn into the isolation room and not worn anywhere else. The first step in treatment is to correct dehydration with electrolyte imbalances. This requires administration of intravenous fluids containing electrolytes. Antibodies and anti-inflammatory drugs are given to prevent or control. The drugs are used to inhibit the diarrhea and vomiting. Most dogs with parvovirus infection recover if aggressive treatment is used and if therapy is given before severe dehydration has occurred. For reasons not fully understood, some breeds have much higher fertility rate than other breeds. The bedding and enclosures in the isolation facility there are large to medium size. Enclosures with the aircon on a comfortable temperature with newspaper on the bottom and a blanket to make it comfortable. The room is well ventilated and is away from other animals. So before you enter the isolation room, you must get the appropriate PPE, example gloves, hands must be washed before the gloves go on and after come off. Mask, the mask is to protect you from the fluids that may spray. Gown, disposable, this is used to protect you from bodily fluids, protects your clothes and skin. Shoes, this is to stop any germs you have picked up from the isolation ward. It does not, so it doesn't get carried throughout the clinic. Sharps container is for all the sharps and needles. Cleaning, F10 is the only product that dismisses parvo from the area. An apron, we do have a disposable apron but rarely used. Biohazard supplies, intravenous fluids and any other medication that is needed. All food preparation is done in the isolation ward, as there is already bowls, food and water in the room and does not come out and we get a can of dog food from the dog ward and feed and water the dog if it feels like eating. Make sure you are wearing the correct PPE when you handle anything in the isolation ward. Cleaning the isolation ward is important. You would use the appropriate PPE to cover yourself. We use F10, which kills the parvovirus in the isolation room. So we will remove the dog to another enclosure in the isolation room. We'll put a lead on him as a restraint and move him to another enclosure. I will dispose the newspaper, an isolation bin and towel and contamination, as it would more likely to have diarrhea and vomit on it.